Can you see the letters properly? Can you see the letters properly in the slide?
Yes, sir.
Yes.
Keep that one. Yes. So the ribs. The ribs are the flat, ribbon-like elastic bony arches. As you know, it creates our thoracic cage, isn't it? Which extends from thoracic vertebra. Extends from thoracic vertebra. That means you are coming posteriorly. Posteriorly, there is a vertebra. As we know, posteriorly we have vertebral column. That's why we are called vertebrae, or we are vertebral animal. So as a vertebral column, we count the ribs from posteriorly, because ribs are coming posterior, starting from the vertebral columns, and it ends at the sternum. There is 12 ribs. 12 ribs. There is 12 pair of ribs. 12 pair of ribs, both right and left. 12 pair of ribs, all ends at the sternum except the 11th and 12th rib, because 11th and 12th ribs are called floating ribs. What are they called?
Floating ribs.
Floating ribs.
Floating ribs. Yes, they because they doesn't connect with the sternum. Only first to 10th will connect the sternum anteriorly. So that's why here it is saying ribs are extending from the thoracic vertebra posteriorly to the lateral borders of the sternum anteriorly. That means it attaches with the lateral border of the sternum. As you can see, their anterior ends are connected to the costal cartilage. The anterior end is connected to the costal cartilage. Every ribs has a costal cartilage at the tip. The ribs along with its costal cartilage constitute the costa. That is the point called costa. Ribs along with its costal cartilage constitute the costa. The ribs and their costal cartilage form greater part of the thoracic skeleton. So sternum is a part, vertebra is also a part, but the most important and greater part is costal cartilage, which is forming our thoracic skeleton. Am I clear up to this?
Yes, sir.
Yes, sir.
Sir, can you explain the costa once again?
Okay, costa means when a rib and cartilage is attaching to each other, it constitutes the costal region or costa. Okay, that's why when any structure going through this part or attaching with this part, you will say this is coastal that or coastal those. Okay, so when cartilage is attaching with the costa part, it is costal cartilage. Are you clear?
Yes, sir.
Okay. So every rib has costal cartilage on its tip, as you can see in the upper picture, that is costal arch. You can see at the right part of this page, the top of the right part of this page, costal arch picture. You can see, don't you?
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
Costal cartilage side view. You can see the costal cartilage. You will go through Visram Singh. You will get a color picture of this. You will see the cartilage in the blue color.
Yes, sir.
Okay. So normally there are 4 pairs, as I said. There is just go through this, as I said. Normally there are 12 pairs of ribs, but occurrence of the accessory cervical or lumbar rib may increase them to 13 pairs. It is abnormal, not always occurs. Or absence of 12th rib may reduce them to 11 pairs. Maybe somebody who have absence of 1 rib, like 12th rib, so they may have 11 pairs. It is normal, not abnormal. It is normal. It is physiological. May occur, but to somebody. But always we will have in general 12 pairs. arrange and general outline. Oh, one thing. When you don't understand, you may ask me in Hindi also and in Bangla also. Not only you have to ask in English. Okay. So you may, if you know Bangla or if you know Hindi, you may ask in your language, your mother language. Don't worry.
Yes, sir.
Okay.
Yes, sir.
Okay. So, but don't ask me in Assamia because I don't know Assamia. Okay. Arranged and general outline. Arrangement and general outline. The ribs are arranged one below the other, and the gaps between the adjacent ribs are called intercostal space. As I already said in the previous classes, intercostal space. You're familiar with this, isn't it? Intercostal
Yes, sir.
space.
Yes, sir.
Because we count the ribs by counting intercostal space also from the anatomical landmark of the sternal angle. Isn't we? Aren't we?
Yes, sir.
Okay. The length of the ribs increases from the first seventh rib and then gradually decreases. Length is decreasing from the first to seventh, then only length will increase first to seventh. One by one will increase. The second one is more than first one. Third one is more than first one. Sixth one is more than seventh. Sixth one is less than seventh one. But the eighth one is less than seventh one also. Then only the ribs will decrease its size. So the most lengthy part, which rib will be the most lengthy one? Who can say?
Seventh rib.
Seventh.
The seventh one.
Yes, sir.
So the transverse diameter of the thorax increases progressively from the first to eighth rib, and hence transverse diameter is increasing up to eighth rib. Hence, eighth rib has the greatest lateral projection. Lateral projection on the lateral projection, but in case of length, we have the largest one, which is seventh rib,
Seventh.
and laterally it is the eighth rib. Laterally, the increasing projection is is the eighth rib. Okay, the ribs are arranged obliquely. As we know, what is the movements of the ribs during the inspiration and expiration? Who can say? What is the movements of ribs during respiration?
Buckle handle movement.
Yes, one of this is buccal handle movement. Another
Pump movement.
pump handle movement. One is pump handle movement, another is buccal handle movement. So if if you want to move like buckle handle or pump handle, you must be oblique. You must be obliquely placed. Okay, so ribs are obliquely arranged, and their anterior ends lie at the lower level than their posterior ends. And when it respiratory times, they get upwards with the sternum, along with the sternum. So this is called pump handle movement. But side to side, laterally, it gets buckle handle movements. The obliquity of the ribs increases. Obliquity of the ribs increases progressively from the first to ninth rib, and hence ninth rib is the most obliquely placed. Remember, ninth rib is the most obliquely placed. The width of the ribs gradually reduced from the above downward. Are you clear up to this?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So the anterior ends of the first 7 ribs are connected to the sternum through their costal cartilages, and the cartilages at the anterior ends of the 8th, 9th, and 10th ribs are joined to the next higher cartilages. The anterior ends of the 11th and 12th ribs are free and therefore called floating ribs, as I said previously. Nota bene says the 10th rib usually have free anterior ends in Japanese. In Japanese, 10th rib usually have free anterior ends. It is you can say DNA modification in case of Japanese, or you can say because of physically they are little shorter than others. That's why they get the 10th or 12th ribs without cartilage. Maybe it occurs, I don't know, but it is may found. 10th rib usually have free anterior ends in Japanese. But it is not
Yes, sir.
important for Viva or written anything. Just know. First rib slopes downwards along its entire extent, and the middle of the each costal arch consisting of a rib and its costal cartilage, except the first rib lies at a lower level than a straight line joining the two ends of the costa. So classification of the ribs according to the features. Now it is an important thing. Come to the classification according to the features. Typical ribs. Khadija, are you there? Khadijatul Kubra, are you there? Are you listening? Okay, move to the classification. According to the feature, typical ribs are 3rd to 9th. And atypical ribs, that is 1st, 2nd, 10th, 11th, and 12th. As we know, 11th and 12th already we have faced that they are floating ribs. So they are atypical. Fast rib are atypical also. This is the most shortest bone, shortest rib, and fattest rib also. Shortest, fattest. In modern culture, we don't like fattest and shortest people. We do body shaming to them. But you must have to have a first rib because you can't live without first rib. There is some of the relations to the first rib that without them you can't live. As we know, the first rib also forms the thoracic inlet. The most important structures goes through the thoracic inlet. That's directly connected to the brain, like sympathetic chain, all of the arteries important, and also thoracic inlet has our two roots, the breathing roots. That means the trachea, the stomach roots. The GIT starts from there. The esophagus also. So important relations of the neck comes from the first rib. We'll go through the first rib next. Then, the typical ribs have same general features, whereas the typical atypical ribs have special features and therefore can be differentiated from the remaining ribs. According to the relations with the sternum, true ribs. According to the relations with the sternum, true ribs are the 1st to 7th rib. Upper 7th rib is the true ribs, and false ribs are about the 8th to 12th ribs, because they are not having individual costal cartilages, or individually not attached to the sternum. They are attached either conjointly or on one point they are attaching 2 or 3 ribs together. So they are called false rib here, 8 to 12th, because attachment on the basis of the attachment with the sternum. True ribs are 1st to 7th and false ribs are 8 to 12th. But you will mostly say, when you are asked the classification, you will say you will start with the according to the features. According to the features, typical ribs and atypical ribs. 3rd to 9th is the typical ribs, and in 10th, 11, and other 1st, 2nd, 10th, 11, and 12 are the atypical ribs. So true ribs articulates as according to the relation with the sternum. True ribs articulates with the sternum anteriorly, while the false rib do not articulate with the sternum anteriorly. They are either articulates with the other ribs, other true ribs conjointly. They are conjointly mainly attaches, or other ribs like 11 and 12 they don't attaches. So according to the articulation, vertebrosternal ribs, that is 1st to 7th articulation, 1st to 7th vertebrosternal ribs, and 8 to 10th, that is vertebrochondral ribs. That means that chondral means the cartilage. There attaches with the vertebra and cartilage. That's why this is called vertebrochondral ribs. Those are 8 to 11th, 8 to 10th, and 1st to 7th are the vertebrosternal. That means they are the typical. They are the true ribs mainly, vertebrosternal. And number 3rd point is vertebral or floating ribs, as we know, 11th and 12th ribs. Let's go to the next slide, please. The vertebral sternal ribs articulates posteriorly with the vertebra, anteriorly with the sternum, as I said. And vertebral condyle ribs articulates posteriorly with the vertebra, anteriorly with the cartilages joints the cartilage of the higher rib, and the vertebral or floating ribs articulates posteriorly with the vertebra, and their anterior ends are free floating ribs. So typical ribs. First, we will go through the typical ribs. Ajim, show the next slide, please. Show the next slide. Yes, this one. So typical ribs. Each rib has three parts. Anterior end, you will get the bones after coming to Bangladesh. Do you have bones with you?
Yes, sir.
No, sir.
In our body.
No, sir.
No, sir.
Like in yes, sir.
In your body. Okay, I didn't say of your bones. You can't read with them.
Oh.
So you need a one which you can touch,
Oh,
which you can take in your hand, which you can
Yes, sir.
take in your hand.
Yes, sir. Yes, sir.
Okay. So typical ribs. Each rib has three parts. When you will get the ribs or when you will get the bones, skeleton, you will buy skeleton full of the sets, or you may buy half of the sets. You may contact with us also after coming to Bangladesh. I will help you, inshallah. But when you buy, you may buy full set or half set. Both will help you. Don't have to bother. But you have to buy, because when you are taking when you are reading with the bones, it will make you clear knowledge. It will make you more brave in case of viva. Okay.
Sir, how is the price?
Price is about 30,000 BDT in Bangladesh. 30,000 or is the most. It depends on the condition mainly. Condition of the bones, or how many years have been gone, how many years have been passed with the bones. About with the better condition or best condition, you may get it within 33, 34, 35. All of this are like this. I think it depends on the condition mainly. Okay.
Sir,
Okay.
is it real
Now-
bone or
Yes, sir.
artificial?
Real bone, real. No, you don't. You're reading about medical science. Okay, you have to need real bone to read.
Yes, sir.
Okay,
Okay.
sir.
Okay, so each rib has three parts: anterior end and posterior end, shaft. Anterior end, posterior end, and shaft. As you know, anterior end attaches with the sternum and cartilages. That's why it is called costal cartilage. And posterior end always attaches with the vertebra. And in the middle part, there is shaft. This is called shaft. S-H-A-F-T, shaft. So the anterior end bears a concave depression. Anterior end has some of the concave depressions. The anterior end bears a concave depression. Here's in the first rib, we have a concave depression. You can see this is an posterior of head, neck, and tibia. In the posterior end, you can see in the picture the upper part is the posterior end. Upper end is posterior end, you can see, and the lower end is the anterior end of the rib. You can see the tubercle here. Can you see the tubercle in the picture? Can you see the
Yes,
tubercle
sir.
in the picture?
Yes,
Yes,
sir.
sir.
Yes.
Yes, sir.
So tubercle has articular part and non-articular part also, and you have neck. You can see the neck just between the articular facets, just between the head and the tubercle. Just between the head and tubercle, you can see the neck of the ribs. Can you see?
Yes, sir.
Yes, sir.
Yes, sir.
These are the typical ribs. Typical ribs. What are the which are the typical ribs? Can you say? From which to which?
39.
39. Yes, yes. So these are the same typical ribs. You can see head, neck, and tubercle, and shaft, and the lower end, and the anterior end. So in the head, you will see the articular facets. two articular facets. You can see the upper articular facet, and between them, between the two facets, there is a crest for the intra-articular ligaments. Intra-articular ligaments, because intra-articular ligaments helps to attach with the vertebra. And lower articular facet, both facets attaches with the vertebral facets mainly. Okay, am I clear here?
Yes, sir.
Okay, you must have to have to be so clear about the picture, because you, when you are saying when you will face the viva, you must imagine the picture or imagine the rib. That's why when you will read, you will go through, you will be with real vertebra, real ribs or real bones. So the shaft is the longest part of the part and extends between the anterior and posterior ends. It is flattened and has inner and outer surfaces and upper and lower borders. Upper and lower borders also. So shaft has upper and lower border, inner and outer surface. Can you see the inner and outer surface marking? Can you see?
Yes, sir.
Okay. So we have inner surface and outer surface and upper border and lower border. Can you see the borders?
Yes, sir.
Yes, sir.
Yes. When how you can recognize the border? You will see the lower border is little thinner. Okay, and upper border is curvy and it is thicker. Okay,
Yes, sir.
you can recognize your upper border and lower border. 5 centimeters away from the tubercle, it abruptly changes its direction. This is called angle of the ribs. There is angle of the ribs. You can see the angle of the ribs because it is changing its direction just 5 centimeter away from the tubercle. You can see in the picture. Keep your eye on the upper part. Just 5 centimeter away from the tubercle, you can see the angle of the rib, oblique line, and in the outer surface. So it is the point where it changes its direction. Okay, and it is mainly lies at the anterior posterior part of the anterior posterior posterior lateral angle of the thoracic cage mainly. You can see this point. So up to this, am I clear?
Yes, sir.
Yes, sir.
Yes, sir.
Then side determination and anatomical position. The side of the rib, how you can determine that this is a right-sided or left-sided rib? You must have to know, because the side of the rib can be determined by holding it in such a way that its posterior end. You will hold the rib like it is in your body. Now you will hold the rib as it is in your body. So the posterior end will be directed at your body and anterior end will be directed to your external body. Okay, or in front. Am I clear?
Yes, sir.
Okay, so this is the side of the rib can be determined by holding it in such a way that its posterior end having head, neck and tubercle is directed posteriorly, and its concavity faces medially. So the concave part will face medially as it is in your body, and its sharp border is directed inferiorly. So you have to hold it as in your body, like little sloppy. So when you are asked to pick a rib by your external or internal or your teacher, you will hold the rib little sloppy as it is in your body, and little sloppy, and posterior end, the head, neck, tubercle will face to your body, and the sharp end will the anterior end will face to your teacher's body, and the thinner border will face downwards, and the thicker border will face upwards, and the outer surface will face laterally, the inner surface will face medially. Am I clear? So this is the anatomical position. Okay.
Yes, sir.
Okay. Features and attachment. Anterior end. Costal end of what are the features mainly? The costal end. It bears a small cup-shaped depression in the anterior end, which joins with the corresponding costal cartilage to form a primary cartilaginous costochondral joint. So this is called costochondral joint. Cartilage and costa connects at the costochondral joint. Posterior end has it presents head, neck, and tubercle. Which line you will don't if you don't understand, you will ask me instantly. Okay, head. It has two articular facets, lower and upper, as I said already. The all those things I have already discussed. Tubercle, shaft, all those things I have already discussed. So you will go through with this. Outer surface and inner surface. You will go through with this. You can see the outer surface. Please show the next slide. Show the next slide, please. All the things I have already discussed in the by seeing the pictures. Okay. So the outer surface it is smooth and convex as it presents two angles, posterior and anterior angle. It has two angles, posterior and anterior angles, as it curves, and generally called only angle. Posterior angle is the only angle, is marked by an oblique ridge. Marked by oblique ridge. You can see the angle. You can identify the angle by oblique ridge on the outer surface, and the anterior angle is marked by a distinct oblique line. So inner surface, it is smooth and concave. It presents a costal groove near its lower border, and the costal groove becomes unrecognizable in the anterior part. And the costal groove. Do you have any question about the costal groove, guys, or your understanding? Do you know what is costal groove?
No, sir.
No.
Did you see in the picture previously I have shown costal groove in the previous picture?
No.
Yes, sir.
Did you see the
Yes, sir.
coastal groove in the picture?
Yes, sir.
Yes, sir. Yes, sir.
Yes. Where that is? Just at the
Midline.
shaft. Just at the shaft, at the lower border, inner surface, isn't it? At the lower border, the inner surface, we get the coastal groove. That groove, that means we need to
Sir, your voice is breaking. Sir, your voice is breaking.
Sir, your voice is breaking, sir.
Sir, your voice is breaking.
Hello,
It just sounds like a guitar, sir.
voice is breaking. Now is it okay?
No, sir.
No, sir.
Now is it okay?
Yes,
Yes,
sir.
Sir.
Yes.
Okay. So inner surface has a groove that is called coastal groove, as it is costa means the rib. So coastal groove, that means rib has a groove in the inner surface in the lower, just near the lower border. So it groove has some of the content also. Which are those contents? The coastal
Sir, your voice is breaking again.
vessels.
Again, cancel again, sir.
Vessels, arteries, and now is it okay?
Yes, sir.
Yes, sir.
Okay. So coastal groove lodges intercostal nerve and vessels. Vessels means vein and artery. Vessels means vein and artery of the same name. That means intercostal vein and intercostal artery. Both are said intercostal vessels. And we have intercostal nerve also. So three content of the groove: intercostal vein, artery, and nerve. Okay, am I clear? So the coastal groove becomes unrecognizable in the anterior part. Anterior part, you can't recognize the coastal groove because it is shallow in the anterior part, and it emerges in the anterior part of the rib, typical rib, but it will be found at the middle of the shaft, mainly at the inner surface and near the lower border. So we have intercostal muscles of internal intercostal muscle.
Yes, sir.
Okay, so the muscles which are attaching to each other, that means if you have muscles in between the first rib and second rib, that is the intercostal muscles. So every intercostal space have muscles attachment with each other, with the ribs connecting, ribs forming them. So intercostal muscles is attached to the floor of the groove, that means costal groove, intervening between the intercostal nerves and vessels and bone, and the intercostalis intimus is attached to the upper border of the costal groove. What is intercostalis intima?
Mm.
No, sir.
Okay, mainly innermost intercostal muscles, that means musculi intercostals intima. This name is also musculi intercostals intima. Innermost intercostals comprise the third and the deepest layer of the intercostal muscles, and third or innermost deepest layer is called intercostalis intima of the muscles, just at the upper border of the costal groove. There is muscles, intercostal muscles, and the third layer, that means the inner layer, is called intercostal intima. I am sending a picture of intercostal intima. You may see. I'm sending it to Ajim. Ajim will show you. So you can see the middle part. The intercostal intima is the green one. Can you see?
Yes, sir.
Yes, sir.
Okay. The intercostal muscle is the red one. Red muscles you can see outside, from outside, and inner layer of this intercostal muscle, that means the green one, is the okay. So we have three nota bene here. Go to the slide. Show the next one, please. Next next picture also. Show the next picture also. That will be more clear. Yes, you can see the muscles here and layers also here properly. You can see how the muscles, the arteries, and the nerves are attached here. You can see the layers from the skin also. Skin, then you will get the subcutaneous fat. Subcutaneous, that means the under the skin. You will get the layer, fat layer of that yellow color. That yellow color things after just under the skin is the fat layer. That means subcutaneous fat, and you will get the muscles. Then you'll get the muscles with bones, mainly intercostal muscles. You will get. This is how our thoracic cage is attached. Cage is formed, and anteriorly you can see the blue one, the costal cartilage attaches with the bone, the costochondral junction. You can see, and you can see again the layers on the right side. So these are the formation of thoracic cage. Okay, show the next. Show the slide, please. Ajim. So we'll go to the next slide. Before that, we have nota bene three characteristic feature of typical ribs. When you ask the three characteristic feature of typical ribs, we have nota bene of it is curved along its entire extent. It is curved along to its entire extent. You know, it is it is angulated. It presents two bends. one 5 centimeter in front of the tubercle, as I said previously, one 2 centimeter behind the anterior end. 2 centimeter behind the anterior end, we have one end, one bend, another bend from the 5 centimeter away from the tubercle, and it is twisted. It is twisted so that the two ends of the rib cannot touch the same horizontal plane. So the mnemonic of this is CAT, C-A-T, curve, angle, and twist. So these are the features of typical rib. When you will memorize the typical rib, you will remember that this mnemonic, that means CAT, curve, angle, and twist. Where it curved, it is to its entire extent. Where it is angulated at the 2 points, and where it is twisted. So these three are the features. Atypical ribs. These are the most important thing in this chapter, because typical ribs you can understand because most of the ribs are typical ribs. So it is easy. But you have when you have atypical ribs to hold, you must have to know what are the atypical ribs and must have to learn in details about the atypical ribs. First rib, as I said, most important ribs here. First rib, you will be frequently asked in your Viva item card terms, all those about the atypical ribs. That is the first rib. One of the atypical ribs. First rib distinguishing features are it is the shortest, broadest, and most acutely curved. As I said previously, shortest, broadest, and most acutely curved. Mostly curved, and it is shaft. Its shaft is flattened. Its shaft is only flattened. It is the only rib which have flattened shaft. Other ribs have curvy shaft, and other ribs have upper border, lower border, all those things. But this shaft, first rib shaft, is the flattened shaft, so that it has upper and lower surface. No ribs have no typical ribs have upper and lower. No typical ribs have upper and lower surface, upper border and lower border. But first rib has upper surface and lower surface, and outer and inner border. Outer and inner border. All those typical ribs have inner surface and outer surface, but this has inner border and outer border, as you can see. So its head is small. Its head is small, as you can see in the picture. Its head is small, rounded, and bears a single circular articular facet. Every typical ribs has two articular facets, as we know, upper and lower articular facet. But first rib has only one articular facet to attach with the thoracic vertebra. Which thoracic vertebra it attaches? As it is the first rib, it attaches with the first thoracic vertebra. Its angle and tubercle coincide. It has no costal groove. Remember, as can you say why it has no costal groove? Why it has no costal groove? Who can say? Who can say why it has no costal groove? Who have understood the typical vertebra? You can answer this. No one.
Because it's wide, maybe.
Because
It's maybe short or wide.
because it is shorter end or shorter surface. Because you know all the typical rib has inner surface and outer surface. Remember the surface.
Sir, because those layers are longer.
But the first rib has
It's
inner
small.
border and outer border only. So the surface is too thin. No surface. It is the border. So how we will get the groove here? There is no space of having groove. Okay. So it has no costal groove, and its neck is rounded and elongated, and it is directed upwards, backwards, and laterally. It is directed upwards, backwards, and laterally. When you will be asked to hold the first rib. You will hold the first rib as your anatomical position as it is in your body, and you will say the first rib, this is the right sided first rib. You will say, sir, this is the right sided first rib or left sided first rib. You will identify your side, and then you will say this is the right sided or left sided first rib, and it is directed, um, it is directed upwards, backwards, and laterally in your body mainly. So its anterior end is larger and thicker. Its anterior end is larger and thicker, and posterior end is smaller. Okay.
Yes, sir.
So what you can see, you will say in the anatomical position that it has one facet at the anterior end, and it is sharp at the posterior end. It has two border. Um, it has two border. One in the inner border and another is outer border, and it has two surface, upper surface and inner surface, upper surface and lower surface. That's all for the anatomical position. First of all, any bones, in case of any bones, you will be asked about the anatomical position. When you are asked to hold one of the bones, you will take the bones and you will start with the anatomical position. You will hold the bone in anatomical position and you will start like this, sir or ma'am. This is the that thing, or you will name this one. Like suppose this is the typical rib. You will say, sir, this is a typical right-sided typical ribs. This is a right-sided typical rib, and it is directed up. It is directed downwards, forwards, laterally. It is directed downwards, forwards, laterally, and it has anterior surface. It has anterior end and a posterior end. Posterior end has head, neck, and tubercle. Posterior end has head, neck, and tubercle, and it has also two facets in the head. One is the upper facet, and another is the lower facet, and it has two surfaces, inner surface and outer surface. It has bend. It has bend at the angle of the rib, and it has a costal groove in the inner surface. That's all. This is the anatomical position, and you explain like this. Okay,
Yes,
you will start like this. Your viva in your viva.
yes, sir.
Then its anterior end is larger and thicker, as I said, and the shaft of the first rib slopes obliquely downwards and forwards to its sternal end, and it is due to the boundary and pleural into the root of the neck. As we know, the structure passing through the thoracic inlet goes at the inner border of near the inner border of first rib. So the pleural apex, apex of the lungs, projects here near the inner border of the first rib. So there are the structures you can see in the picture. Can you see the first rib picture?
Yes, sir.
Ajim, show the slide of the first rib, not the 11th, 12th rib. Show the previous slide, please. Previous slide, please. So that they can see the first rib picture. Ajim, show the first rib picture. Ajim, someone mention
Sorry,
Azim
sir.
because Azim is not hearing.
Sir,
Okay,
sir, sorry.
as you saw in the picture, the first rib. Sorry, what do you say? Okay, this one is the picture. So pictures. Now you can see the picture, and I will tell you the details. Side determination. So how you can determine a side of this first rib? So the first rib, yes, this one. So how you can determine the side of the first rib? Side of inside its larger end directed anterior and its smaller end directed posteriorly, because smaller end attaches with your vertebra. So the surface of the shaft having two grooves separated by a ridge. Surface has shaft. Surface has two groups, but no inner border and outer border have no grooves. But surface is broadened so that it has two groups. Surface of the shaft having two groups, upper surface and lower surface, set by a ridge. It's superiorly. Their group
Sir, your voice is breaking again.
Can't hear you, sir. आवाज नहीं आ रही है सर आपकी.
Sir, you are not audible.
this one. Can you see the scalene tubercle, please? Can you see the scalene tubercle?
Yes, sir.
Anyone? Okay. So everyone seeing the scalene tubercle here. So scalene tubercle, from the scalene tubercle there is a ridge coming to inner end to the outer end. In front of that, that means the anteriorly there is a anterior groove and posteriorly there is a posterior groove. You can see the grooves. Not group, just groove. GROOVE, groups. So posterior groove and anterior groove. So in case of atypical rib, it is at the surface, upper surface and lower surface. So at the upper surface, you will get the posterior groove and anterior groove, two groove, which is separated by a ridge that is coming from the scalene tubercle. You can identify it easily. And in case of people rib, get the groove at the inner surface, at the so so that will not that is upper surface and lower surface has no groove. Am I clear?
Yes.
Yes, sir.
Okay. So in its concave border, it is directed inwards, and the concave border is directed inwards, and convex border is directed outwards. It is the easiest way to determine the side. Trick for the students for side determination of the first rib: keep the rib on the table. If you keep the rib on the table, stop considering its position in your own body. Now, note that the rib belongs to the side on which its both ends touch the surface. That means, if it is the right-sided first rib, then it will. If you keep it on the table, the lower surface touches the table smoothly. So the rib belongs to the right side. The both ends touches both ends of the right side. Both ends of that rib will touch the table surface. Will touch. Okay. There will be no imbalance. If the rib is placed on the wrong side, then only its anterior end will be touching, and the will imbalance. Features and attachment. The inner border feature, you can see in the right picture, it presents a scalene tubercle about its middle as feature. In the left picture, please keep your eye on the left picture. It presents a scalene tubercle about its middle, and tubercle and adjoining part of the upper surface provides attachment to the scalenus anterior muscle. You can see in the right picture, scalenus muscle, attachment to the scalenus anterior muscle, scalenus anterior, as it is at the anterior surface, at the anterior side, so it is scalenus anterior, and it provides attachment to the Simpson's fascia, as I previously said as I said in the previous class. Simpson's fascia, that is subpleural membrane, that suprapleural membrane. That means it covers the upper side of the pleura, apex of the pleura mainly. The supra, that means upper, and pleural membrane. So Simpson's fascia, it provides attachment to the Simpson's fascia. Who provides attachment to the Simpson's fascia? Who provides the attachment to the Simpson's fascia?
Inner border.
The inner border. Okay. So inner border has 2 points. Number 1, it presents a scalene tubercle at its middle, and tubercle and adjoining part of the upper surface provides attachment to the scalenus anterior muscle. This is the first point. And second point is it provides attachment to the Simpson's fascia, which is other name is suprapleural membrane. Okay. So as we know, it forms the thoracic inlet, the inner border. The outer border, it provides origin to the first digitation of the serratus anterior about its middle, just behind the groove for the subclavian artery. You can see in the pictures the subclavian artery. Can you see? Can you see the subclavian artery just
Yes,
before
sir.
the ridge?
Yes, sir. The blue
Yes.
color vein.
Yes. So the just before the ridge, you can see the subclavian artery. So outer border provides origin to the first digitation of the serratus anterior muscle about its middle, just behind the groove for the subclavian artery, and superior or upper surface, you will find it is crossed obliquely. Upper surface, superior surface. Now it is the superior surface, that means upper surface. It is crossed obliquely by 2 shallow grooves. You can see anterior and posterior grooves, separated by a slight ridge. You can see the ridge is continuous with the scalene tubercle, as you know. The anterior groove lodges subclavian vein. Anterior groove has some content like subclavian vein, while posterior groove lodges the subclavian artery. So which groove has which thing? Anterior groove has anterior groove has subclavian vein, and posterior groove has subclavian artery, and lower trunk of the brachial plexus also. You'll get the brachial plexus later in details, but now you'll just remember that brachial plexus is lower trunk is crosses this posterior groove of the first rib, of the superior surface of the first rib. So the area behind the posterior groove up to the costal tubercle provides attachment to the scalenus medius muscle. Scalenus medius, that means we got scalenus anterior at the anterior side, and now we're getting the at the superior surface we are getting the scalenus medius muscle. We got scalenus anterior, sorry, serratus anterior. Yes, we got scalenus anterior previously, and serratus anterior also in the outer border. One is scalenus, don't mix up with this. One is, yes, surface. It is related to the costal pleura. Lower surface is related to the costal pleura. Pleura is a covering of lungs, as you know. So lungs, as it is inflated inside the chest cavity. So lower surface attaches with the costal pleura.
Yes, sir.
Yes.
Okay. So next is the neck, the most important thing. We can't finish in the lower surface.